What types of braces do you offer?
In general, there's two types of braces. There's the standard braces that are the metal braces, the train tracks as people call them. And there's also the aesthetic braces, which are the clear braces. They could be made out of plastic, out of ceramic. So this is the more aesthetic choice. The difference there is that the metal braces are smaller and they allow more control. Plastic or ceramic in general, they are a little bit more bulky and it cannot be finished as precisely as metal. So with metal braces, it's much faster treatment, maybe even 25 to 30% faster, and it's much more control. So the final result may be slightly better than with the ceramic braces. However, if aesthetics is important, we can certainly choose the clear braces, particularly in the front region where when people smile, you can see their teeth. In the back, it doesn't matter so much.
Is there an ideal age for braces to get the best results?
Usually, it depends actually on the situation. We can put braces even when kids still have baby teeth in the back. If the front teeth are a problem and we want to align them, we can definitely use braces there. In general, for any orthodontic treatment, whether it's braces, whether it's Invisalign and aligners, the sooner the better. Generally speaking, when the adult teeth are there, that's when most people start doing the braces or Invisalign and aligners.
How often do I need to come in for braces adjustments?
Most of the time, after the initial placement of braces and a first check, which we do within a week or two, people come in every 6 to 8 weeks for the adjustment visits.
Do you have any advice on caring for braces?
With braces and generally with good oral hygiene, first of all, brushing is the staple. Everybody usually knows about brushing their teeth. Mechanical brushes, particularly Sonicare or ultrasonic toothbrushes, are, I think, the best. Some people like something like Oral-B where the brush head just rotates. With the sonic toothbrushes, the bristles vibrate, and I think it's much more gentle and does more good work rather than the one that rotates, which it may be harder for those rotating heads to get beneath the wires, around the brackets, etc. The other very useful thing is something, for example, like a water pick that spits water right between the teeth and around the wires. So those things are great for cleaning food debris and bacteria. The other thing is floss that has a little hard end, floss threader or something like Oral-B Super Floss, which we thread under the wire and then we can floss teeth like usual. It takes a little bit of extra time. However, it's very important to keep the teeth clean because after all, who cares about nice straight teeth if they have a whole bunch of holes and the gums are ready to kind of spit the teeth out.
Besides aesthetics, what are signs you might need braces?
We treat many people with braces and aligners for jaw joint problems. Many people refer to this as the TMJ, which stands for the temporomandibular jaw. People may have headaches, people may have migraines, clicking, cracking, locking jaw. Even the neck, back, shoulders can be affected. In that case, we make sure that the jaw is aligned properly. And then when we know where the upper and the lower jaws go, then we move the teeth towards each other along with the bone so that the teeth and bone can support the jaw in a proper position.
How can I schedule a braces consultation at your office?
If you would consider orthodontic treatment, braces, or aligners, you can call our office and you can make an appointment for a free 10-minute consultation. We will answer your questions. I will look at the particular case by case. And then if you're interested, if it appeals to you, we will make the appointment for examination and records, and we will go on from there.
What foods should I avoid with braces?
Generally speaking, when you have braces, you should eat a little bit softer foods. By saying that, you should still have a good diet. However, if you like chewing on ice or eating hard candy, which by the way, you shouldn't have too much candy anyways, you may want to cut those out. If you're eating pizza, you want to cut it in small pieces and chew with your back teeth. Same thing would apply to carrots, apples. So you have to be a little bit more careful that you don't bite hard on the braces, because if you bite hard on the braces, you can very easily break the bracket of the tooth, and then you have to come for an extra visit. And if the tooth, for example, moves back quite a bit before you get to the office, that may prolong the treatment significantly. So having the right foods, which in general is softer foods and chewing mostly with the back teeth, is very important.
Can you share the cost of braces and whether insurance covers them?
The cost of braces varies. Simple cases may start around $1,000, and difficult cases, very complex cases, may range up to $8,000 or $10,000. Insurance in general will tell you whether they cover orthodontic treatments. So whether it's braces, expanders, or aligners like Invisalign, we can take a look at your insurance. And if it says that orthodontic treatment is covered and you fall within a range, for example, it may be from 7 or 8 years old until the person is 21 or 25 years old, then we would send a predetermination to your insurance. And once we receive the approval, then we can proceed with the treatment and you will be reimbursed to the amount that the insurance covers.
Do braces hurt, especially during wire tightening?
In general, there's been quite a bit of progress in the field of orthodontics, particularly with braces. So oftentimes people ask me, oh, when I come back, are the braces going to be painful when we tighten the braces, etc.? There's lots of misconception. There was main progress in the wire technology. So when you have braces, people often refer to them as train tracks. Well, those are the wires that actually do the movement. The braces, the brackets themselves, are just an attachment to the tooth, so the wires can go through the bracket and the movement can happen. We use high technology, as we call them, high-tech wires, a little bit more expensive than the old-fashioned stainless steel wires. However, they are very gentle. In this case, truly, we can say less is more. The teeth do not want to be exposed to excessive forces. So our wires are only active at the body temperature. We start with very gentle, soft wires which get people used to the movement, tooth movement. So for the first few days, just like with Invisalign or any other liners, the teeth may be a little bit sore, a little bit tender to biting. However, after about a week, the teeth get used to movement. And when you come for your next visit, we don't tighten the wires. We actually change the wires into slightly larger wires so we get a little bit more movement again. So those changes are very gentle. And in general, the old horror stories from 50 years ago or more are no longer true. Most people, after the first few days up to a week, are very comfortable and they kind of forget that they even have the braces. That's why they bite sometimes into something hard and break the bracket off.